Most aesthetic treatments don't fail because they're done poorly. They fail because the face wasn't prepared properly. And today I want to talk about a concept that's finally getting the scientific attention it deserves: prepping the canvas. But I also want to show you why, in integrative aesthetic medicine, prepping the canvas goes far beyond muscles and injectables. This video is inspired by our 2024 peer-reviewed article titled "Optimizing Facial Aesthetics: Sequential Application of Botulinum Toxin A and Dermal Fillers for Enhanced Results." The author is Constance Hall, a nurse practitioner and aesthetic educator. The article was published in Plastic and Aesthetic Nursing, the official journal of the International Society of Plastic and Aesthetic Nurses. I'll summarize what the article teaches, and then I'll show you how I expand on it using an integrative and holistic aesthetic approach in my own practice. I'm Dr. Fred Bloom. I'm trained in integrative, holistic, regenerative, and aesthetic medicine. And what I appreciate about this article is that it puts clear language and data behind something experienced injectors already understand intuitively. Sequence matters. The article focuses on using botulinum toxin first before dermal fillers. Specifically, it looks at weakening depressor muscles before placing filler. The goal is simple: reduce downward pull, create a more stable, relaxed foundation, and allow fillers to be placed more precisely. According to the article, this sequential approach can reduce muscle interference with filler placement, lower the risk of filler migration, improve symmetry and predictability, reduce patient comfort, and often reduce the total amount of filler needed. In many cases, the article points out something important. Sometimes Botox alone already creates enough improvement, and that's a key clinical insight, because more product is not always better. The science behind this is anatomy and biomechanics. The aging face isn't just losing volume, it's being pulled downward by overactive depressor muscles. When those muscles are weakened first, the face becomes easier to sculpt. That's what the article refers to as prepping the canvas. And I agree with that completely. But this is where integrative aesthetic medicine goes a step further, because muscles are only part of the canvas. In my practice, the real canvas is the biology underneath the skin. If the internal environment isn't supportive, even perfectly sequenced Botox and filler won't behave optimally. For example, if collagen synthesis is impaired, biostimulation won't mature properly. If inflammation is high, collagen breakdown outpaces repair. If hormones are off, skin response changes dramatically. If nutrient reserves are low, healing slows. So in integrative aesthetics, I also look at hormonal balance, inflammation, nutrient availability, mitochondrial health, oxidative stress, and healing capacity. This doesn't replace aesthetic technique. It supports it. And when biology is optimized, aesthetic treatments last longer and look more natural. That's why in some patients, aesthetic care may include hormone optimization when appropriate, nutritional or IV support, regenerative therapies, light or energy-based treatments, and gut and detox support when indicated. This isn't about being extreme. It's about being aligned with physiology. One of the most interesting things I've learned over time is this: the face often shows systemic stress before lab work does. Poor healing, short-lived results, excess swelling, and fragile tissue. These are not injector failures. They are biological signals. Integrative aesthetic medicine listens to those signals. So for whom is this approach? It's for patients who don't just ask, "What can you inject?" but instead ask, Why is my face aging this way? This article confirms something important. Sequence matters in aesthetics. And integrative medicine reminds us that systems matter even more. When you combine both, outcomes improve and results last. Before we finish, I'd love to hear from you. Have you noticed better results when Botox is done before filler? Have you ever had aesthetic results fade faster than expected? Do you think aesthetics should address internal health or stay purely cosmetic? Drop your thoughts in the comments. I read them, and they often shape future videos.